Asthma. Precautions: identify and avoid triggers, such as allergens, smoke, and exercise-induced asthma triggers. Use prescribed medications regularly and have an action plan for managing asthma attacks. Chronic obstructive pulmonary disease, COPD. Precautions: quit smoking and avoid exposure to secondhand smoke. Protect yourself from air pollution, respiratory infections, and occupational hazards. Follow a regular exercise routine and take prescribed medications. Pneumonia. Precautions: get vaccinated against pneumonia, especially if you are at a higher risk. Practice good hand hygiene and avoid close contact with individuals who have respiratory infections. Follow a healthy lifestyle and maintain a strong immune system. Tuberculosis, TB. Precautions: follow infection control measures, such as covering your mouth when coughing or sneezing, and wearing a mask when around others. Take prescribed medications for the recommended duration and avoid close contact with individuals with active TB. Lung cancer. Precautions: quit smoking and avoid exposure to secondhand smoke. Minimize exposure to environmental carcinogens, such as radon gas and asbestos. Adopt a healthy lifestyle, including a balanced diet and regular exercise. Consider regular checkups and screenings if you are at a higher risk. Pulmonary embolism. Precautions: maintain a healthy weight, exercise regularly, and avoid prolonged periods of inactivity. Take necessary precautions during long trips to prevent blood clots. Follow medication regimens as prescribed, especially if you are at risk. Pulmonary fibrosis. Precautions: minimize exposure to environmental irritants, such as dust, pollutants, and chemicals. Use protective masks and follow safety guidelines when working with potentially harmful substances. Follow treatment plans prescribed by your healthcare provider. Cystic fibrosis. Precautions: follow a specialized treatment plan, including airway clearance techniques, medications, and nutritional support. Minimize exposure to respiratory infections by practicing good hand hygiene and avoiding close contact with individuals who are sick. Occupational lung diseases. Precautions: follow workplace safety guidelines and wear appropriate protective equipment. Minimize exposure to hazardous substances and maintain good ventilation in the workplace. Participate in regular health screenings and seek medical advice if you experience respiratory symptoms. Idiopathic pulmonary fibrosis. Precautions: minimize exposure to environmental pollutants and irritants, including cigarette smoke and airborne toxins. Maintain a healthy lifestyle, including regular exercise and a balanced diet. Follow treatment plans prescribed by your healthcare provider.